I am here to teach how to interpret the spirometry report. Now sometimes it's very confusing when you get a spirometry report and you see the Z scores written on it, and it becomes difficult if you don't know uh, what are exactly the Z scores and how to interpret it. Now if you see this graph, this is a standard deviation graph of a standard deviation of normal people. That means if you see on the left hand side it's written 5th percentile, and on the right hand side it's written 95 percentile. It means this area in the graph, it covers the normal values. That means 90% of the population has normal value which lies between the 5th and the 95 percentile. It means any values that are on the left side of this graph, that is on the left hand side of the 5th percentile, or any values that are on the right hand side of the 95% of the curve, are not normal. So a value, if it lies within the 5th percentile and the 95 percentile, is considered as normal. Now what is the lower limit of normal and the upper limit of normal? Now if we see, the 5th percentile corresponds to the minus 1.645 Z score, and on the right hand side similarly plus 1.645 Z score. Now this minus 1.645 is the lower limit of normal, LLN, and the on the right hand side is plus 1.645 is the upper limit of normal. Now any value, suppose a value is minus 1.768. Now this value, if we see, it lies on the left hand side of the 5th percentile. That means this value is less than the lower limit of normal. Similarly, if some volumes have a Z score of minus plus 1.8, then its value lies on the right hand side. That is, it is not normal. Basically, what we see, that in spirometry we measure the lung volumes such as FEV1, the FVC, and the FEV1 by FVC ratio. Now if we see that the FEV1 Z score is more negative than 1.645, that is, it is less than the lower limit of normal. Okay, so like this, with every values we have to see the Z score. Spirometry report, you can see that I have taken two values, the pre-bronchodilator value and the post-bronchodilator value. Usually in practically we use the post-bronchodilator value. In exam, if only pre-bronchodilator value is given, take the pre-bronchodilator values. Now what we see is that the Z scores of pre-bronchodilator value I have not written, because as we are not considering these values. So now the Z scores of the individual values for the post-bronchodilatory values are written. Now first, when we get a spirometry report, what we have to see is this FEV1 by FVC ratio. Now this ratio, if it is less than the lower limit of normal, and what is the lower Z score of lower limit of normal is minus 1.645. Now what does it indicate? It indicates this is an obstructive pattern, as simple as that. If this ratio is less than the lower limit of normal, that is the minus 1.645, it is obstructive disorder. Now when we get an obstructive disorder, what we next have to see is whether there can be a restriction component present or not. Now how can we say that? Now exactly which spirometry it is difficult to say. We need a DLCO for that, because we need the total lung volume which we get in the DLCO. But we can get a fair idea looking at the FVC. Now if we see the FVC in this case, let's first see in this example FeV1 by FVC ratio is 0.55. This is the ratio. And what is the Z score? This is minus 3.35. That means it is less than minus 1.645. That is, it is less. It is less, it means it is an obstructive pattern. Now we got an obstructive pattern. We can also see that usually in obstructive patterns the FeV1 is less than the lower limit of normal. It is C minus 2.21. It is also less than minus 1.645, because in obstructive pattern the FeV1 falls more than the FVC, because there is obstruction in the air while expiration. So that's why FB1 is reduced more than the FVC. Now if we see this FVC value, it is 4.7 and the Z score is minus 0.09. Now this value lies between minus 1.645 to plus 1.645. So this value lies in the normal distribution. That means FVC is normal. So in this case the patient is having an obstructive pattern with no restriction. That is a purely obstructive pattern. For example, if we have another spirometry report in which the ratio is less than the lower limit of normal and the FVC is more negative than minus 1.645, suppose it is around 3.8. Similarly the ratios will also change. I am not changing this. Just for an example, suppose it is an obstructive pattern. You get an obstructive pattern that is it is less than the lower limit of normal and the FVC is 3.8 and the Z score is written as minus 1.832. Now in this case you get a fairly idea that FVC is also reduced than the normal distribution. That is, FVC is reduced at the lower limit of normal. That means a restriction component is present. Now to confirm that, we need a DLCO, which I will tell you further in the next video how to interpret DLCO and spirometry together. Now suppose if we get the FeV1 by FVC ratio that is more or equal to the lower limit of normal. In this scenario we get only 2 DDs. If it is more than the lower limit of normal, either it can be a normal spirometry or the patient be having a lung restriction. Okay, so when we see the FeV1 by FVC ratio more than the lower limit of normal, we have to see whether there are 2 DDs, that is either it is a normal spirometry or there is some restriction.